I'm Dr. Nabil Mehta. I'm a fellowship-trained shoulder and elbow surgeon at EmergeOrtho. One of the most common conditions I see is shoulder arthritis, which is the loss of cartilage in the ball and socket joint of the shoulder. And this can range from normal wear and tear to complete bone-on-bone arthritis, which can be quite painful. When you come see me for this condition, we'll first get x-rays to form a diagnosis, and we'll talk about what your symptoms are and what's been bothering you. We may also get advanced imaging like MRI or CT scan to look deeper into the shoulder, since everybody's pattern of arthritis can be different. We always start with non-surgical measures like anti-inflammatory medications and injections, which can really be quite helpful for a large number of patients. When all of those things have been exhausted and surgery is required, we typically talk about performing a total shoulder replacement, which is where we remove the arthritis and replace it with metal and plastic pieces that restore the smooth gliding motion of the joint. This procedure is very reliably successful in restoring function and decreasing pain with patients with arthritis. I've learned this procedure from world experts in the field, and I've taken a lot of lessons from them that I hope to implement in my own practice to take care of patients in the community here.